So you don't need a motion to open the meeting. What you would do, Dan, is that you would call the meeting to order and then you'd ask for a roll call to establish if we have
Right.
quorum
Well,
going forward.
I call the meeting to order and I'd ask for roll call.
Right.
And so Lisa Knoll, present.
Oh, present, sorry.
Liz,
Here.
Mike,
Here.
Cookie,
Here.
Lisa Hotley.
Here.
Is there anyone else? I don't know who generic host is. And Dan Rosenthal here. So do we have a quorum?
How many is it?
5, 6. Yes, you do. You have a quorum.
So,
Would someone make a motion for approval of our meeting minutes on May the 2nd?
So moved.
Any seconds?
Second. 5 seconds.
All in favor of approving the May 2nd meeting minutes? Say aye.
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 Oh, well, now
Opposed?
hang on a second. I spoke with Lily and Eunice, and I'm not sure, maybe Matt can direct this. I spoke with Lily and Eunice this morning, and she said she's actually been attending the last couple meetings, and I did not have her as an attendee. I didn't see her on the video screen. So is that, do
So
we need an
Susan,
amendment?
I would say that we, took roll on those meetings. I didn't attend the last meeting, but I attended the other ones, and I don't remember her checking it, like for establishment for roll call. So I would say that we could certainly put a note that she said that she had attended, but I would keep what we reflected as what was recorded for the purposes of the minutes, that we took roll
Okay.
call for it. And so if we didn't have the official verification that she was there, not that we're not distrusting her, it's just we did a roll call, and I don't believe that she was there for at least that part. But if somebody does join later, then we'll make sure that we add that in the meeting. So if there's anybody on here that joins later, please make your presence known so we can record that in the meeting minutes.
Yeah. So I did recognize that she did join later. She wasn't there for the roll call at the last meeting, but I did see her name on the screen.
The last meeting?
Yes.
Okay.
it's here.
Oh, Wayne's here. Good.
Good morning. Sunny,
Morning.
Morning.
Beautiful day.
So we'll move on to, so I guess we
So,
have,
sorry, just to clarify, is that we have not approved any minutes yet. We are taking the minutes with the addition that Lily and Eunice was in attendance at the last
Okay.
meeting.
so let's revise that request to vote on approving the minutes with the revision that Lillian did attend that meeting. All in favor?
Aye.
Aye.
All opposed?
Aye.
Unanimous. Old business. Let's see, I'm going to move on to Lisa Knoll's agenda, and I'm going to let you speak because I know you have to leave early.
Okay, thank you. Yeah, a couple of things, and I noticed also on the agenda, the master plan on aging. So one of my updates is about that statewide needs assessment or survey that's going out. That's part of that, and the first mailers, postcard mailers by the company, and it's called Polco. But the postcards, anything that's going to go out is going to be co-branded with either the state DHSS logo or Aging Ahead. So those mailers are going to start going out next week. And then I believe the timeline is the first week in July, the AAAs are being asked to, and others, state folks too, are being asked to supplement those mailers with outreach to community partners and other entities that can spread the word about these surveys and how important it is for those to be completed if people are able. And there will be options on most of them. And I'll send you, when it comes out next week, I'll send you a copy of that, because there's a QR code, but there are also phone numbers. So this company that we paid to do this is available via phone for individuals who don't, aren't into the QR code or don't have a smartphone or whatnot. And then there also will be a mechanism for us to do those surveys in person if need be. So we're still trying to work out all of those logistics, but the point is we want to tell as many people as we can that this is happening, that it is, this isn't a scam, this is a real deal, and it's really supplementing the work that these, the subcommittees for the master plan have done, and it will further inform that work going forward. So I'll keep you in the loop on that, but just so you know, that's all getting started next week. A couple of other things. And part of this is related to a comment that was made at the committee of the whole on Tuesday. One of the council members asked about what they can do. I think we were talking about the property tax credit circuit breaker, and one of them, somebody asked what can they do to help us help support our position on that. And one of the things that we do every year, the AAA in the city, as well as Aging Ahead, we do a joint meeting every summer with our state legislative folks, both senators and representatives. And last year we had about 17 or 18 of them show up in Ferguson at our event in Ferguson. And we had one city alderperson who came. But I think the consensus was, and we might have debriefed this group after that meeting, because I think we collectively said it might be a good idea, or it would be a good idea to also invite our local elected officials to that, so that they can hear both what older adults are saying in the community, as well as what our state level of elected officials are responding with, and kind of how they're leaning on various subjects. So I'll keep you in the loop on that as well, but the date on that is August the 15th. And I don't know that we have a location yet, but plans are underway to do that same thing, to host.
What is that event being called?
It's actually the silver-haired legislature is the convening entity, but the AAAs are supporting it. So it's a legislative open house, maybe we'll call it that. So yes, it's state level folks from city and county.
Was there a good attendance on that, Lisa?
There was great attendance.
Really?
Yes. Yeah. So I thought we came away from it last year feeling like it was a little bit of a missed opportunity to not have more of our local elected officials there as well, to be part of that conversation. So anyway, I just want to kind of make that right this year and get word out to them. So again, once we get that more details around that, I will send that out so we can save the date to people.
So that was Councilwoman Days, I think, that asked the question at the.
Yeah, so I just thought when she was asking that, it just came in my mind, that this is a way, for them to be there and be part of that conversation with both the older adults as well as those state level.
Who's our rep for her?
Advocates, and there are other advocates. So I'm seeing Sarah and Jamie on the call too, and others, and so that many of us are at those convenings annually, and so it's just a way for everybody to get on the same page.
Who would be the appropriate person to invite Councilwoman Days to this event?
Well, I guess what I'm wondering is if we shouldn't invite all.
Yes.
Absolutely.
Right. So once I get the details, I will share that with this group, and then everyone invite their person,
Councilman.
maybe.
Thank you. Do you have any other agenda?
Lisa, would
items?
that also include inviting the senators of our district?
Yeah, so we do the state level folks. We invite senators and reps that are elected at the state level, and that's who typically joins us. But what we haven't done, and it's just been an oversight, I think, is more inviting those local folks. So that's what we want to be able to do. So I just have a couple of other things really quickly. actually one primary, and I did talk to Liz about this on Tuesday. So Liz has been the champion for the broadband initiative, and especially in our area. And so she was gracious enough to hook up a person from AT&T and a couple of others too. But the person that she connected us with from AT&T is going to work with us to, and this is not public. I mean, it is now because I'm talking about it. But we haven't really ironed out the details, and we'll. So they have a program where they donate laptops to children pretty regularly, and so we're asking them to donate laptops to older adults, both in the city and St. Louis County. And there's quite a few that they're going to be able to donate, but we have to figure out the logistics for this, because typically people sign up again with a QR code and they put all their information in, and we know that that's just probably not going to be the best way to get outreach to the folks that we need it to get to. And so, and we want to target certain areas where there are the most underserved older adults, maybe that are homebound, isolated, so on. So anyway, it was really good. We had some really good meetings with this individual at AT&T. They're very excited about that partnership. So thank you very much, Liz. And again, I think it just speaks to, Dan, what you pointed out at the committee of the whole about, collaboration and, us collectively, connecting those dots that need to be connected so often. So anyway, more on that as it progresses. Thank you.
Excellent. Thank you.
Lisa,
Yes.
one other thing is I know it's on the agenda, but since you're talking now, what, if anything, is going on World Elder Abuse Awareness Day?
So we are at this point relying on the state presentations that are happening, because we were not really able to get anything in terms of a training. We've done that every year, those lunch and learns. We've not been able to get that organized locally, but the state is putting out some really good materials and some training. So we're kind of counting on our partners at the state, and we'll get that information out next week. One of the things, this is kind of exciting, we are actually, the big Ferris wheel at Union Station is going to be lit up purple. So
Great.
that's kind of cool. And so we'll get some, some press out about that. And this is still in the works, but Stiefel is working on having some buildings lit up purple as well on the 14th, on June the 14th.
Great. And Lisa, just kind of a little follow-up on that is I did email Lisa Jones at the prosecuting attorney's office just to ask what, if anything, was being done in that office. And she said they can't move ahead on anything. They just don't have the staff. And she said that she talked to the people in St. Charles, and they are in the same mode. They just can't dedicate the time that's needed to really address elder abuse and neglect. So
It's really
disappointing
because there are so many folks that are eager to be at that table and to help with that effort. And it'd be nice. And again, I know that was part of our presentation on Tuesday, but I'd like to see us push that, because it's very much needed. And there are lots of really smart people that want to join that effort. We just need some way to coordinate that.
Excellent. Thank
So
you.
this is Cookie. You mentioned purple. Can you give me a little bit more detail on the purple?
So
color?
purple is the official color of World Elder Abuse Awareness Day, which is June the 15th. But we try to do things throughout the month of June. And the St. Louis Elder Financial Protection Coalition historically has done with various partners. Last year it was with the FBI. We did some webinars and some press, events and things. So this year we're lighting some buildings up in purple, which we've been trying to do for several years. And then we'll try to get press around that too, so that, we get a little bit of mileage out of it.
And that's June 15th.
Yeah, well, the light up business is going to happen on, because the 15th is a Saturday, so we're going to try to get the lights to happen on the 14th.
Okay. Thank you.
Lisa, another little follow-up on this is I did call the Ladue Fire, Creve Coeur Fire, and Frontenac Fire on what they do with, what is their protocol if they are called to a home repeatedly for a fall. And, you know, is there, and basically I heard all of them said the same thing, which is they have no protocol. They try to get family and friends to help out, but there's really nothing that they have as a follow-up with older adults, other than just sort of getting neighbors and friends to do. So what I suggested to the Ladue Police Fire Chief was that they all have medical people who they have on staff, because his big question about having, you know, referring someone to Aging Ahead, for instance, for a meal, was that they don't like to refer people to anyone that they don't know. So they're concerned about HIPAA and things of that nature. So
We need to get to know them.
exactly. So he said that he would be happy to lead that and to work with, you know, you and me to see how we can get the fire and police to recognize that recommending that they have a meal delivered to the home of somebody who seems to be a little bit isolated and alone is something that is not going to compromise that individual. They can
A number of the council members did, you know, bring up the fact that many of their constituents are served by the fire department more than anybody else when they have an issue.
Oh, that's exactly what prompted my call.
Yeah, and I sent both of you and Dan, Liz, an email back. So one of the things, and we've been in AAA world, we've been talking about this forever, and wanting to figure out how to get to all of those first responders. And it's really hard because, you know, of all the municipalities and all the division and such. But, you know, one of the things, not in addition to the meal, there are plenty of other supportive services that people need that we can be the gateway for. But also there are crisis numbers that they need to have. So, you know, whether it's APS or it's some sort of behavioral health crisis line, so what I'd like to see us do is put together some sort of resource, something. And I'm happy to be part of that and figure out how we can get to that. Get to those folks and yes, let them know who's out there in the community. They don't have to do it all by themselves and shouldn't, honestly.
And that was kind of the conversation I had with the police chief this morning, was just that, you know, there are resources out there, and connecting those dots is something that could be very beneficial. And he agreed, and they all talk to one another as well. There is you know, a collective group.
Thank you.
So.
I see that Jamie's hand is up. Let her weigh in.
Oh, thank you. Well, on that note, I know it used to be at the county health department for decades would have a community health nurse go out. They had an agreement between the police and would go out and make a visit. So just that used to happen. I forget what the program was called, but it happened during the 1990s and all the way up to 2010, I think. Just a side note. Lisa, can you give us an update on what's going on with the budget cut from the state budget for home and community-based services, the $60 million?
No, I don't have much information on that, actually.
Okay, I don't either.
We're still waiting. We just found out about some things yesterday, honestly, and we're still waiting to see how all that's going to shake out.
Okay. All right. Thank you.
Thank you. And Lisa Hotley also mentioned that she needed to leave early, so I'll let you weigh in as well. Lisa, are you there?
Yes, I don't have much of a voice, so I think that's why I'm just listening today. So I don't really have anything new to add any further with communications or any further with the CHIP thing. I'm being invited to some meetings, and to further the, but they've kind of targeted me, I think from my previous work in the mental health world, they're targeting me to be in that emerging group of mental behavioral health for all of the CHIP population, which isn't exactly what my request had been. So I'll keep you posted if we get any further on that.
Thank you. So back to the agenda, old business presentation to the county executive and members of the county council at the committee of the whole, which was a couple of days ago. And you know, what we did was, so we, you know, the report was given to them a couple of days before the meeting, as well as a copy of the PowerPoint. So all the council had an opportunity to review it before we made the presentation. So the presentation focused on really what the you know, kind of executive summary said in the cover letter, which was about collaboration and about how we all have achieved so much in being able to not just talk to ourselves, but invite people outside of our commission to inform us about what the you know, the important issues of current issues are, and to help us address them, as well as to collaborate with outside agencies to get things done. And then we, you know, the presentation was a little different than past years, where we tried to focus on, you know, the 4 focus groups, which we always do. But in addition to talking about our past year's accomplishments, we listed certain goals and requests. So at the last commission meeting, I'd asked everybody to send me their ask, something that they would want us to ask the council specifically for. And we collected those asks and incorporated it into the presentation. And that became the focus of the presentation. And there was a lot of dialogue back and forth with the council members about these asks. Nobody said no to anything we asked for. They didn't come out and say yes. But I think, I mean, my impression was that it was encouraging. Tell me if you had a different impression, those that attended. But the things that we asked for instance, was an additional $85,000 to help fund the NIH survey to increase the number of participants. Am I getting that right, Lisa?
Right, it's the NIH research through WashU needs additional participants with the grant pad, so that money would fund that.
So we asked for $85,000. We went into some detail about what Jamie, you have done in the city regarding home repairs and the inventory and study done in conjunction with UMSL on, you know, documenting what the need was. And that, you know, we were asked a lot of questions about, well, what is the need in the county? And we kept saying, well, we need this study to help us understand what the need was. We don't have the data that is available now in the city because they performed this study. And we said the study in the city cost roughly $60,000. We would expect something in the county to be, you know, commensurate with that. We don't have a number, but we made an ask for funding for that study, and we made an ask numerous times during the presentation for that study. And we also spoke at length about having the need for a summit with all participants in home repair, you know, throughout the continuum of services, from the people actually with the funding who, you know, who can then contract with small contractors to get the work done. So all the not-for-profits that do that work and the governmental agencies that do that work, all the way down to, you know, the contractors that do the work. And we mentioned that the weak link in the chain appears to be that there aren't enough small contractors available to do this kind of work, and that we really think that training needs to be done, and that we want to partner with, and we have spoken with the Director of Workforce Development at the county, Greg Laposa, and he actually brought this up. He thought we should have a summit. And so what I've been working on for the past couple of months is calling individual organizations and asking if they'd like to participate. I probably have a dozen yeses so far, and I'm still calling. So we have people from immigrant organizations, like International Institute, they want to participate. Mosaic Project wants to participate. Jamie, I've spoken with you. I think you had voiced an interest in participating. Rebuilding Together wants to participate. SHED wants to participate. A lot of the organizations that are providing the actual services want to participate, and they concur. They basically have been confirming what we've been telling people, which is they have long waiting lists. If they had more contractors available to them, they could serve more people. And so I've also brought it up. I'm on the Affordable Housing Task Force subcommittee for the Missouri, the continuing master plan on aging, and this became a big topic at our last conference call. And there's a member of that of our task force that actually is a contractor in the Kansas City area, and he thought that there were other stumbling blocks for providing service that were more administrative. And many of the people on the call confirmed what I've been saying, which is no, in St. Louis, it's that there are not enough contractors. And he said, well, I'm a contractor. If I'd known that, I would have brought my business to St. Louis sooner, but I'm going to start investigating that now. So that individual will want to participate in the summit. Paul Weatherford, who is the senior planner for St. Louis County and who's involved in the steering committee that I'm now participating on for the 2050 comprehensive plan. He attended the council meeting and came up to me afterward and said that he would like to make a presentation to our commission, but he's also interested in participating in this summit. Anyway, it's a long list, and I've spoken with Carpenters Union, the Plasterers Union, and others that say that they would be interested in participating. The what's the name of the organization that Clayco founded? I spoke with Rachel Bomer with gosh, what's it called? The Institute. It's the Construction Career Employment Institute, or CCDI. Development Institute. They're interested in participating because they are training high school students in the construction industry. So we have people on the training side that are interested, people on the not-for-profit and governmental side that are interested. The CEO of County Housing wants to participate. Kevin Poe from the Housing Partnership, another not-for-profit that's not only doing home repairs in neighborhoods in the north side, but also building new construction. He said that he can't service all the need. So I think this is something that seems to have legs.
Seems like you've done a yeoman's job on that, Dan. That's very interesting. Would be good to get that information out there.
Yeah, so we didn't get a nod from the council that they would do anything specifically, but we do have support from Dr. Page on this. So we're gonna have a summit. I don't know when yet.
Dan, one of those groups that you might want to add to your list there is veterans.
Excuse me?
Is veterans.
Veterans.
There's and what might help you on that is UMSL has a specific, they have sort of a veterans spot for I know, and I'm going to have to look it up, but I can't remember. I'm drawing a blank on the name, but there is a young guy who I met several years ago, who is, his entire work is adapting homes for veterans to make them accessible. And I know I'll look up his name, but that was what he was doing. And I would think he would be very interested in being a part of a summit like that. And he also has the people who are doing that work. think it's primarily in the city.
Okay, if
Jamie,
you can get me a name, I will contact
I will.
the person. That'd be great. I did also wanted to mention that in our last meeting, we were under the impression that Habitat for Humanity does not do home repairs, but what I found out on the Master Plan on Aging call, in the Kansas City area, they are doing home repairs. And I didn't know if they were doing it in St. Louis, but they are doing it. So there are lots of organizations that are doing this kind of work. And our story to the council was, everybody's doing this. Not everybody's talking to each other about this. And wouldn't it be valuable for everybody in the chain to communicate so that the services could be brought to the public in a more efficient way?
Summit.
So that, and I let others talk about the other asks if they would like to, or the discussion, if anybody else that attended thinks there's something we need to share. Lisa Hotley, we did mention the need for better data regarding older adults for CHIPS. I think that was one of your requests, and that was in there as well. I think there was a follow-up question from Councilman
Was it Hancock?
Hancock, yes, as well on that. And you know, he was kind of challenging us to find the data elsewhere. And I said, well, I don't think the data is necessarily there.
Yeah, it's not, it's been a low interest population for many groups, as we've always discussed here. So I'm actually going to reach out with him separately and meet. He had asked some specific questions when I did my interview. And so I wanted to follow up with him to see if if there were some things in District 7, particularly in my Kirkwood area. I'm meeting with the new mayor and several people to kind of review what we have services here, and if there are things, how we might be able to scale those to all of District 7 or to other municipalities through some sort of collaboration.
Yeah, some of the questions by certain council members were kind of asking us to, you know, prove a negative, and you know, it was, you know, so isn't the information already available? Was a question I heard a couple times, and our answer was, well, if it is, we don't know where it is because, you know, we haven't found it. So Jamie.
Oh, just getting back to your comment about the home repair network. We just did fund Paraquad to help with their ramp up program. And but I do know that Missouri Foundation for Health did give them a grant, or the home repair network a grant to hire someone, I think full-time as a coordinator. I didn't know if you had mentioned that or not.
I did not know that.
Actually, kind of a bit of a follow-up on that. I heard last night that the Starkloff Institute got a $2 million donation, and one of those, that part of that donation was accessibility, and so that's a huge donation for that particular organization. And it was from the former wife of Jeff Bezos.
Wow. So, so they are what, they would provide grants for this sort of service? They're a granting agency? Or, I mean, they're a foundation that would provide grants then. This is just additional $2 million to provide grants?
Well, no, the $2 million was just a flat out gift. And that, but one of the, but one of the big things that the Starkloff Institute is all about is accessibility, and that particular is more about employment. And I think one of the focuses on that particular grant was going to be making sure that employers are have, you know, are easy for people to get in and out of the building. Simple as that.
Okay.
And Dan,
Well,
I
I'm
just
just
put,
wondering-
I just put in the chat, information about the grant that Missouri Foundation for Health gave to the Home Repair Network. And it not only includes a person, but it includes, getting a list of contractors interested in bidding work and also, some marketing to raise awareness.
Is there a link to them? Thank you. My chat is a tiny little box.
Oh.
Hard time reading it. Thank you, though. Could somebody, kind of document that chat item in our notes?
I've got it.
Thank you. Other items, did I miss anything that we discussed at the COW?
The only thing is to reiterate that one of the things that I took away from that was the need to contact first responders. So it was thanks to the questions and that dialogue that we had that I reached out to Ladue Fire. So it was a very constructive meeting, and Dan, you did a great job.
Thank you. Oh, there was another point. So I think Councilwoman Days and Councilwoman Webb, I think, brought up some of the service providers in their community that we didn't know a whole lot about. Do you remember the name of the organization? Something Oaks.
Yes, sir. Oak Street.
Oak Tree.
Yeah, and they're providing healthcare in the community, and it's primarily, well, I think it's 100% Medicare based funded. Do I have that right?
I believe that is so. I have a couple connections with them. This is Cookie again, and I have a couple, even for as I guess the fire department.
Yeah.
Again, when I did that tour, that was one of our first stops, and he's the chief, Kevin Henderson. He brought up a lot of things that they provide for resources for older adults, and he said it used to all be for seniors, but it's now community based. So I'm going to get with him on some of this conversation, especially the protocol on the medical, getting with falls and stuff, and see what they may do. Councilwoman Rita Day was on the tour, so I think that tour from that we did had a lot to do with some of this stuff that you guys are talking about.
So should we be involved in this, or should we get to know these service providers?
My opinion is yes, but I'm just one commission and I'm new, so I'm just learning how all this goes, Dan. And again, I think you did fabulous.
Thank you.
Dan, how many council members were in attendance?
They had a quorum. The only people missing were Councilwoman Clancy and Councilman Tracus, I believe.
Okay,
All the rest were there, and Councilman Clancy had her assistant in attendance, so Craig was there, and I spoke to him afterwards.
good.
So I
And would you
invited
like me
her,
to
and
send
she
you
had commented that she was going to be out of town, but that he would be there.
Would you like me to send you Kevin Henderson, the chief for out in Spanish Lake?
Yes.
Okay.
Thank you.
All
Yeah,
right. I will.
And Cookie, I will also let the police chief that I spoke to know that you're working with him.
Okay. I think I'm just going to do email introducing Dan and Kevin. And then, of course, if it's anything, Liz, that, I need to do from this end, Dan, you or someone will let me know from there.
Thank you. So it's just one follow-up. Since this, I don't think our commissioners were that aware of these for-profit entities that are providing these services. And, is it worthwhile to invite somebody from one of these entities to tell us more about what they do and where they do it? Is there any
Can I
interest
say
in
one
that?
more thing, Dan? Do you also want me to send you the Oak Street people to also?
Yes, please.
Okay, and to Liz, I'll do, okay. Thank you.
I appreciate that. There's nothing else on the committee of the whole. Move on, I think, Lisa Hotley, I think you already had an opportunity to talk a little bit about CHIP data. Is there anything else about CHIP data updating anybody knows about? We spoke about home improvement program a little bit. Universal design, where that stands, the collaboration that we're doing with the Commission on Disabilities. You know, Carol and I have been participating in the kind of the redlining and editing of the brochure that we want to present back to the Home Builders Association, so that that meeting has not occurred yet. It's been, you know, kind of refined and refined and refined, and I don't know that that the Commission on Disabilities has actually sent anything to the Home Builders Association yet. That's the next step. Since they were the kind of the generator of this whole project, we didn't feel like it was our responsibility to send the brochure to the home builders. So we'll touch base. I don't know if Sue Orton has any updates on that. Sue?
Yeah, the only thing I do have as an update is that you and Linda Baker are going to get together and try and set up a meeting with Lisa Clancy. And
Right.
that hasn't occurred yet.
That's right.
So
Yeah,
I don't have
so
to, I don't have to report on that now.
Okay, so Linda will contact me with that
Yeah.
potential meeting. I did have some emails about that, but I didn't get an actual invitation. Yeah, thanks for reminding me on that one. Elder Financial Protection Coalition, Liz, and broadband.
So, you know, what Lisa said, we've got, you know, AT&T working on helping with that. I'm still participating, though I did miss the meeting earlier this week just because of too many things on the digital inclusion. But there's basically AT&T, and there's an organization called PCs for People, which is it's nationwide, and basically they go to everyone from lawyers' offices to businesses, and they rotate out their computers every several years. And so PCs for People goes, collects all those computers, cleans them all up, and has them available for members of the community. And those are the PCs that Lisa will be able to, you know, get and use to pass on to older adults. And then AT&T has a very has a special rate for older people that makes it affordable. So and then on the protection side of things, as I said a little earlier, Lisa Jones would, I mean, they would love to be doing more for financial protection for neglect and abuse, but right now they just don't have the staff, and nor do they have it in St. Charles. So I don't know what's going on with the individual who is supposed to be looking into those multidisciplinary task force in the state of Missouri. It seems to be in limbo just because there's nobody who can really take it on.
Thank you. Property tax relief for older adults. That was another thing that came up in our conversation. A number of the council members were very interested in our opinions on the whole property tax freeze issue and where it stands. And Carol Rodriguez, you know, fielded those questions. And you know, some of the council members wanted to nail her down on a specific, you know, like cap on income, or, you know, what, you know, she wanted us to make recommendations on, you know, what those means tests would be. And I don't know that we wanted to field those questions. We're not experts in that area. But we did talk a lot about the circuit breaker reform and our support for that. So, you know, I think where it stands right now, and I think we talked about this at our last meeting, was that the state's interpretation of their what is it, SB 90 is that there couldn't be any means testing, and that the county's approved ordinance really was in violation of that. And so we don't really know where this all stands. So
Yeah,
we're gonna.
I was just going to add, if I could, I don't remember who said this on the council, but they referred to this toolbox. And so the property tax credit, the freeze, and home improvement and repair are all, you know, prongs, I guess, or pieces within that toolbox that, you know, if it's just one of those, it's not going to be as effective as if we can deal with all of them.
Yes, it was a very shrewd response from Carol when asked about whether we supported the freeze. And Carol said, well, it's one important item in the toolbox, but there are many other items in the toolbox.
Good response.
Dan?
Yes.
Sorry, maybe I should start my video if I'm asking a question. I was curious if with the property tax, you know, that question came up in, I think, those of us that went through the appointment interviews this these past couple of months, that question's coming up. They're looking for guidance. We're asking them to make decisions, but we're not providing them resources to make those decisions. So they keep asking for specifics. And, you know, I think we all had the same response. We're not the experts, but we also didn't tell them where to go to get that cap number. We didn't tell them, you know, we didn't really tell them how to do what we're asking them to do. And I think that's what they're looking for. And Jamie has her hand up.
Yes, and I think we did say that we would get them information on the circuit breaker reform. I thought that's something that Carol might have said.
But I'm not sure we're giving them what they want, which is how to vote on something and how to present something. I think they're looking for backing from us so that if they threw a number out there, that they would say, you know, this is the number that the Older Adult Commission or that the agencies, you know, the AAAs. So I think they're looking for some specifics on it to make the job easier. And I thought we could maybe be that conduit.
That's a good point. I think the AARP, I thought in some of their literature, did they say that was there an income cap of 48,000? Am I remembering that correctly, Dave? Or your speaker, you're on mute, I think.
Okay, sorry about that. I'm in my car. Yeah, the current circuit breaker, I think the cap is 34,000 for married, somewhere around there, and the bills that were winding their way through the legislature had that go up to 48,000. At least that's the last I heard. But of course, all that got balled up in the shenanigans in the last couple of weeks and it didn't get passed. But it is still one of our top priorities to get that modified. So, you know, we're just going to start again next year and do the same thing, try to get that passed.
So, I mean, Carol did respond by saying that the current caps were way too low and that many people are kind of kicked out of the program, and but we didn't mention the 48,000. Maybe we should do that. I know Jamie's had her hand up for a while.
I would recommend that you all review the economic security information that the University of Massachusetts at Boston's gerontology program has produced county by county. It looks at economic security for older adults. This is actually something that we did when we did the very first needs assessment before the Aging Commission was formed. I worked with Lori Fiegel on this. The Missouri Senior Report also has this data. And so what it looks at is what does it take for either a single older adult who either rents or owns a home, or a married couple who rents or owns a home. And when I talk about owns a home, some people, older adults, still have a mortgage. So it even breaks it down to whether they have a mortgage or whether their mortgage is paid for. What does it take for them living in St. Louis County? So it's county specific. What income do they need in order to be have economic security? And so I can send you all a link to a presentation that Dr. Muchler did for Empower Missouri last month, or I think it was in April. And I would really recommend this committee look at that, because you'll have the exact amounts that people would need in order to be able to be economically secure and have enough funding to be able to not end up becoming unhoused.
Thank you. Yeah, we did mention the data point reference from the Missouri profile. In the St. Louis County, out of the roughly 184,000 residents that are over 65, I think I might be getting the numbers wrong, but it was around 34,000 individuals who were spending more than 30% of their income on housing. That was the only data point I think that we had that we could reference.
This will give you all the data points you need. I'll put the
Excellent.
link in the chat.
Thank
Yeah,
you.
Yeah, I strongly second Jamie's comments there. I think if the council's looking for, I mean, basically they're asking for a policy proposal of, hey, what's the right number? And, you know, the number needs to be based on something, you know, credible. And, you know, the 48,000 in the updated circuit breaker, you know, who knows where that came from. And most of that probably was just to take the current number from 2007 and bump it up for cumulative inflation. So if we could tie it to some credible study, you know, that's the way to do it. Although, again, my reading of the bill that passed was that counties weren't allowed to set a means test. But granted, I haven't done all my homework on that yet.
Yeah, that's what we got out of it as well.
Yeah. And it starts at 662, no means test. I thought it said you don't have to apply for it. The counties would just do it automatically based on data that they have about age. And there are a couple other things I'm trying to pin down exactly, you know. And, oh, and the freezes, if somehow house prices go down and the property tax goes below the freeze that was set, then the homeowner gets the benefit of the downside, but they don't have to pay the upside. Yeah.
I think we go back to our challenge being we're throwing out all these property tax conversations. The public's getting very wary, and you know, our ultimate goal would be seniors count to pass the larger senior levy, and we're almost shooting ourselves in the foot by having all of these conversations with so many unknowns out there. I actually had somebody that I had taken to the hospital last week, and I heard in the room next door a group of older adults having a conversation about they're going to stop paying property tax because of this new thing that their governor was doing for them. And I mean, it was all over the place. And then they said, well, no, we're still going to pay some, but you just contribute what you can. And so this misinformation in these informal settings is growing. Social media is creating more issues, but that if we're looking at our long-term goal would be to have a senior fund. I think the more we could get this information nailed down and show that this is different than the senior fund, it's going to be important that we keep that in front of our leaders and the public, I think.
Yes. Well, we mentioned both the senior fund and the misinformation you're referring to at the meeting. So I think Carol mentioned that there were a lot of people out there that thought that they wouldn't have to pay property tax now, and that they need to be better informed about that. And we also mentioned that you know, some of the programs that are occurring in the city that are not occurring in the county are due to the fact that they have a senior fund and we don't.
Exactly. One other thing I asked Jamie, just because Jamie and I met with Sarah Crossley, and Jamie, could you talk about that? and how that might impact us?
Yeah, so Sarah Crossley is with an organization. It's a public health organization that's also funded by Missouri Foundation for Health. It helps local public health departments become accredited. And there was a grant from Trust for America's Health that they were awarded to help local public health departments become age-friendly. And the reason that's so necessary is because most health departments, as you can see from the CHIP and the CHA, do not focus on older adults with data, and then therefore programs and services. So they actually have a grant. I don't think it's a large grant, but a grant. But unfortunately, they're working mostly with more rural health departments. However, when Lisa and I met with them, we're like, look, by simply working with St. Louis County, you can impact like 20% of the state's population. And St. Louis County, has been designated as an age-friendly county. And so, just trying to get them more engaged with you all, and really looking at trying to look at the resources that they can bring to St. Louis County through their grant that would help with future CHAs and CHIPs, so that you would have more local data and you would have more, hopefully, programs or services focused on older adults. I do know that this county and the city CHIP, Community Health Improvement Plan, does focus on chronic disease. However, there's nothing it's very specific with older adults, which is a shame.
So I'm wondering if there's a vehicle to get this information out in the county through the comprehensive plan. So if somebody would give me a concise statement about what we need to be doing that we aren't doing in the county, I will communicate that to the planners. And again, we have an opportunity to invite Paul Weatherford to present to us in September. He said he wants to present to us about the comprehensive plan. So it's also an opportunity for us to share where we think the gaps are in the county related to older adults. So this seems like a pretty big one.
One area, if you look at the county's the county's strategic statement and their plan that was put together without us a couple of years ago, older adults and Pacific Islanders are lumped together as really important parentheses, not important at all to the population. So if you're looking at less than 1% of the county as Pacific Islanders, and you're looking at nearly 50% of St. Louis County as older adults, you can see that there's a disconnect there. And
let's say 20%. I mean, we're approaching 20% now, even though the current data doesn't. I mean, the last data point I saw was 18% of the county is over 65.
If we use 65, yeah, we used 45 for all age friendly. An older adult was 45. In my dissertation work, we used 45. So anyways, and that allows for prepping and moving into that early older adult stage. So there's evidence behind that 45 marker, which puts us at nearly 50% of the population. But I say that, and then the action that Jamie was pushing for an action at our meeting. And one of the things we talked about, perhaps this was a brand new grant to them. I don't think it had a lot of legs yet, but if we would invite maybe Sarah to come speak again, it would connect us for a potential collaboration. Let's say have her speak in early spring or late fall. They've 6 months of this grant under their belt. And so it would connect us. That would be the action I would recommend. I think Jamie is kind of pushing for something like that as well, right? Is that correct, Jamie?
Yes. So, I apologize for not mentioning that. I'm always pushing for something.
Well, it makes sense, yeah.
Can we, who would be the appropriate person to reach out to Sarah to invite her to?
I can do that.
Thank you.
But I don't want to invite somebody until we have, should I just, should we assign a month or find?
Yeah, so I think Susan and I spoke a little bit about inviting Paul to the September meeting. The one question was, do we want to have a meeting this summer, or after this meeting, do we go on hiatus until September? I mean, we can meet as frequently as we want. Our only, requirement is that we meet 6 times a year, and we always exceed that. So I don't know. Unless somebody says, let's meet again, we're not meeting again until September.
I think we have a lot of subcommittee work to do. I don't know if we couldn't just report via email an update, maybe once a month or something, because there's a lot going on with other meetings. And, so a verbal.
Sorry, Lisa, just to interrupt on that, is that because you're a public body, we can't actually communicate that way via email? Is that if we're talking to the entire board about an update, it actually has to take place during one of these meetings?
Okay. I thank you for that. So maybe that's not an option, but we really are just, if we want to drill down into specific areas, and it'd be nice to really come back strong in the fall with a plan for presentations, so that those collaborations that Liz is so good at, the rest of us can try to do those, because I haven't done a lot of collaborations with these groups. This would be a great opportunity to figure out. And Spring Schmidt, who used to be the head of our health department, she is with this organization as well. Jamie, what's the name of it?
It is, I forget the name. I'll find it.
MOFES, it's MOFES, they call it. It's an acronym. But anyways, it seems like an organization that for the first time now is adding older adults. And so I think it's malleable. And I think they would appreciate some sort of help with this grant. And if they wanted to get the grant renewed, I think we could be a conduit for that. So I'll reach out to her. Yes, that's it.
Okay, so I see a link from Sarah.
That's it, Sarah. MOFES. They call it MOFES, or I don't know.
Okay, and I did not see a link from Jamie. I think you said here's the link, but I didn't see the link.
Okay, I will email it to you because it's not working, I guess, on the notes. So and it's the Missouri Center for Public Health Excellence, I think is what it's called.
Okay. Let me see, where are we on the agenda? Oh, Cookie's had her hand up for a while. I'm sorry, I missed you. Do you remember what it was that you wanted to weigh in on?
And Cookie, or can you give me the information? Because a lot of people ask me and I don't want to misinform them. Will the tax property go up in July as planned? For them to register for the tax freeze?
Okay, I can kind of address that. The latest information I have is that the applications will be available in July. But the tax freeze itself will not go into effect until 2025.
And also, Susan, will that include, because people are asking, would that include the disabled? They want to know, are they part of it? Or is it just for age? So now understand that this is just the most recent information I have. It does seem to be fairly fluid at the moment, but you do have to be 62 years of age or older. There's not a provision for just specifically disabled.
Susan, isn't there also that tax break? One of the things that I remember hearing was that it actually, because it applies to only a portion of the property tax, is going to actually result in a very small change. Is that correct?
No, that was the city of St. Louis passed the ordinance that they passed was to only freeze the 20% that went to the city of St. Louis. The bill that is
on the governor's desk to be signed now says that that is not allowable. There are no restrictions on the taxing districts that could be limited. Like it has to be across the board on all taxes. So that the city of St. Louis will have to go back and revisit that, providing the governor signs it, and there's no indication that he won't. So,
and the same with the county. I mean, the county has.
You do
has a
have to
limit as
live
well.
in the house. Yeah, the bill is, because we actually had a lady call who lives in Wyoming. But she owns property here, so she wants to apply for the tax freeze. And it's like, that was somewhat alarming to think that people could do that. But I did go back and look at the actual bill that was passed. And it does not, it says you do have to live in the house. And your name has to be on the deed for the house. So that's comforting that, you know, it's like everybody will get a tax freeze for every piece of property everywhere. So but that's the latest information that I have. That could have changed. So, but that's what we're understanding at this point.
And per the instructions of Carol, and I want to say Dan also, they had me working on part of the project for some of this, and I reached out to a whole lot, quite a few of the senators and representatives. I sent the feedback to Dan and Carol because they had me working on that. And then we had a brief conversation with Lisa Knoll when we did the commission meeting, the community of the whole. And I was explaining to her that, which she already is aware, that a lot of seniors are going to have problems with this, of how to apply. And both of us suggested, Lisa also, that maybe we do it on a way like you do taxes, where they can apply for this stuff. It's a lady, I think Donna Ray or something from the library. She happened to be on a meeting that I was, and she was saying that they would be readily able to try to help, which I mentioned to Lisa. Because it's going to be difficult for seniors to do this. And will they be prorated back? If they miss 1 year, will they be able to go back? You know, it's a lot of questions involved.
Well, I think that's the challenge with the whole property tax freeze. The concept was a good one. The implementation is where it's starting to really bog down. And other states have done it. It is true. People call and tell us that all the time. And it is true, but I think a little more thought was possibly put into it on the front end, whereas with what the state presented last year and then modified this year, it's like a scramble for the counties to figure out how to implement that, because, well, the council said the other day they're expecting between 50,000 and 80,000 applications. And I think they're closer to the 80,000 number from numbers that I have seen. And that is enormous. Like, that is just huge, because one, they did not have software that would help them with this. Like, they don't know how old taxpayers are. So that's the big issue right there. So they not only had to get software that would address this issue, but the current staff is not going to be able to handle it, because the software will do part of the work, but all of that information has to be entered into the software program. So they mentioned the other day about trying to hire, you know, people, older people, to help with this. And that's good. I couldn't help you with any of that at this moment, because there's been no postings of that or anything. So I don't know where they stand at that point, but I think that's probably why the implementation will actually occur for the 2025 tax year, which is not a bad thing for people, because it's 2025 is a reassessment year. So if they will freeze it at the 2024 level, that's still a good thing. That's not you know, some people's taxes will go up a little bit. Just because a school district or a fire district got an increase, but your property will not be reassessed until 2025. So, but I think just if you think about the volume of work involved, and I know Core, I have been very active and very verbal with people saying, you need to get help on this because they're going to do it an efficient way, which is to let people do it online, which is great. A lot of people can do it online. That won't be a challenge. But the ones that are possibly the most vulnerable are the ones that will not be able to do it online. And that's where you're going to need some, just like community outreach, you're going to need community partners to get out there and actually fill out the applications for people. And so that hopefully is the plans develop. And I do know, Rob, the Department of Revenue is working on this. They're not just sitting there, but it's huge. Like it's a much larger project than just saying, we're freezing taxes. There's a lot of work that has to go into it. So that's about all I know on that. I do want to say two other things that are not about that, but Lillian Eunice has joined the meeting. She joined it a while back. And I did email Paul Weatherfield about presenting at the September meeting.
Excellent.
I haven't heard back, but.
Thank you. Thank you. And I did receive, Jamie, thank you for sending that Friday Forum Poverty on Aging presentation. I'm wondering if we can just forward this entire presentation to the council. I don't know that they're going to look at all the slides, but you know, I guess the important single slide on here is the, oh gosh, what was it? I think it was $37,000 or $38,000 for an individual renter. Let me see, no, with a mortgage. I'm sorry, individual homeowner with a mortgage, and it's $37,596 is the elder index per year, and for an older couple with a mortgage, it's $50,016 per year. I don't know that that would be what we would suggest as a threshold, but at least a minimum.
I would get is that St. Louis County specific? I can't remember because she did it for the state.
That's the national average.
Oh no, so Sarah had put in the chat a link to the data, and you can go on that link and find specifically for St. Louis County, and I would send them the data for homeowner versus paid mortgage, unpaid mortgage for a couple and a single, and I would send them the data for St. Louis County for renters for a single and a couple older, you know, and those are the data points I would send.
Okay.
And then I would send them where you got the information from, Dan.
Okay. I can do that. Yeah, I have Sarah's links. Okay, I'll wait until after the meeting. Look at those. So, where are we on the agenda here?
Sorry, Dan, I do see Sarah Levinson raising her hand here.
Oh, okay, Sarah, please.
Thank you all. I'm glad to be back with you. I'm at JFS with the Older Adult Services Department. And so we do a lot of case management and we subsidized homemaker services. We recently got a grant for home repair. So I want to connect with you about that. And I just want to thank you all. This meeting has been so helpful and informative, and it's been a while since I've attended. So I'm really grateful to be here. And thank you all for the work you've been doing. Susan, right now, is there anything like in our communication, we have a newsletter that reaches 1,500 households. Is there anything right now that you think that we should say about the freeze, or right now just don't say anything and wait until we get more information?
I really think right now, don't say anything. I think there's information out there that has been very confusing to people, not intentionally, but it's just a lot going on with it. And there's a lot of misunderstanding with what it's going to look like, what it's going to do, how you're going to get it. And I think once more information comes out, and if the application actually comes out in July, there should be some pretty concrete guidelines at that point. You know, how is this going to, how does this work? Do you have to reapply every year? You know, what if your assessment does go down a little bit? You know, how does that impact it? You know, how do you take advantage of that? And so I think once that happens, your newsletter would be a great vehicle to just say, here's what it really is. Because I think that's what people just really need right now more than anything, is just information that's accurate. Not it's going to change in 2 months or, you know, next legislative session or whatever. It's just really confusing for folks. So it's confusing to me. And I mean, I kind of work with it and hear, you know, things from the Department of Revenue, and I'm still confused. So I think they're probably not saying anything at this moment.
It's hard for people to, you know, look at this legislation and think that it's not being punitive towards the cities. I mean, you know, if we have services that we don't want to lose, to have a tax freeze that is going to limit dollars going to public services, it just seems disastrous. I'll stop editorializing now.
You know, Dan, in a kind of in agreement with that, I think this is also the issue we have with a senior tax. That it is our senior fund, creating the senior fund is we're freezing on the one hand, and on the other hand, we're asking for additional revenue.
Yeah, I see Lillian has her hand up. Lillian.
Hello to everyone. So sorry that I have not been able to speak to you before, but I just learned from Susan. Thank you again, Susan, for making sure that I could get on today. But I've been on otherwise in silence. I just wanted to ask real quickly if we can possibly, you know, once this information about the tax situation is resolved, can we work with the municipalities so that we can have sessions in each of the municipalities for the seniors? It could be sponsored by the commission and municipalities all throughout St. Louis County. We could have it as a, you know, as a commission sponsored information session. We could set it up, you know, once that's done. I think that would help the commission. I think it'll help the seniors, and really would be a, you know, a broader public presence of help from us to older adults who live throughout St. Louis County. Is that, you know, is that something we should consider?
Well, all I can speak is personally, and the answer would be yes. I don't know. Once I get more information, then that would definitely be a suggestion I would make. Well, my understanding now is the plan is to get the applications everywhere.
Okay.
And I don't know what that definition is, but that it would be everywhere. And it will be a big media push for sure.
Okay.
So I think some of these issues will be taken care of and addressed, but if not, I will do everything I can from my end to make sure we reach all of those folks who are most in need of a tax freeze.
Okay.
So that's all I can tell you at this point.
I think that also might be something where we can go to our county council members and ask them to,
yes.
That's a good way for us to respond, as you know, Dan said earlier about saying, what can they do for us? That's where we can say, listen, you need to have these sessions in your district.
Okay. And do you know Joan Horn?
Yes, I do know her, and she's working.
I would talk to her because she's the county executive's municipal liaison, and I would talk with her about it. I can also reach out to her and see what if she's given any thought to this, and if not, you know, we can certainly make that suggestion to her.
Okay, I am in touch with at least I'm in touch with at least 24 mayors of municipalities here in St. Louis County. And while that's not, that's not all of St. Louis County, at least that's a start. But if we do this, we could actually set it up like they do those free tax sessions, where once this issue is resolved, we would have the subject matter experts who will know the law, and we'll have the forms available and all of that in each of those municipalities. Set it up like a town hall meeting with booth, with tables there and assistants there and snacks there or whatever, so that people can come, listen to, and know exactly what to do. And that way they can be led in the right direction and not have, a variety of people that don't really know. I mean, we could work through the county council to make sure that subject matter experts who will have been trained on this will be able to come to us whenever it's resolved. We'll be able to come to our municipalities and host these sessions with the municipal leaders. So that was the only comment I had. Thank you.
Thank you. The next item on the agenda, I think we talked about aging ahead, but CORP, do we need any updates on CORP?
I really don't have any at this point. Fortunately, it's a little bit of a slow period for us, so I'm happy to say I don't have any updates.
Well, thank you. Then, no, we have no new business. I'm going to just say the only new business really is to determine whether we want to meet in July or August. And if there is not in any interest to do that, and what I was hearing is that there are a lot of other meetings happening this summer. So some people were saying, maybe let's wait until September, but I just wanted to get a consensus. Anybody who's okay with our next meeting be September, just raise your hand so we can get a kind of a straw poll on this. Anybody who'd like to meet before then? Okay, happy summer. Are there any share outs from any commissioners?
This is Sue Orton. I'd like to give you a few little updates on the County Commission on Disabilities. It seems like a lot of the information that you all covered is kind of a duplicate. But we did have a presentation by Amy Ellis from the County Office of Community Development, again, talking about, the types of partnering and things like that, as far as, ramps and other kinds of home repairs. But we also asked her about supporting affordable housing. And she mentioned some of the organizations, the Home Investment Partnership, the Down Payment and Closing Cost Assistance Program, and agencies like Better Life Housing Partnership and Beyond Housing that do provide some of that. The other thing is we finalized our recommendations for the Board of Elections, sent them, our recommendations, and they were, I believe, implemented in a flyer that I saw. And again, it talked about the fact that voting has to be accessible for people. Like if you're visually impaired, those booths that have visual impairments should be working. And also curbside, that you can ask for what they call pollster people to come out and help you with voting. And then Dan talked about the Universal Task Force, so that takes care of that item. Under our new business, Cheryl Rose mentioned that a Harvey Ferdman had worked on a new police program for de-escalating physical situations with an emphasis on the mental health disabilities. And apparently the St. Louis County Police Academy have agreed to it. So another one of our members talked about Coloride and the fact that they are deciding whether their reservation window should be shortened one day. I don't have an update on that though. Let's see what else. I think that's about it.
Thank you. Thank you, Susan. You just reminded me that Coloride was a question we got from the council, and Lisa Knoll fielded that question and said that Aging Ahead doesn't contract through Coloride, but has been contracting through kind of an Uber-like entity, and it's been going fairly well. So
Dan, I have
does
one. There was one
Yes.
thing I meant to bring this up, but my voice is coming a little bit better back this morning. The plumbers, I saw Labor Tribune had an article, the plumbers and pipe fitters partnered with the Rebuilding Together, and then they did a 1-day blitz. And I can send you this article, but they did a 1-day blitz at the end of April, providing free plumbing updates to low-income elderly and veterans. So again, that was that collaboration. So, and you're familiar, everybody's familiar with Rebuilding Together. I think we discussed them last month.
I think I've seen that article. Yeah, and I reached out to the plumbers and I didn't get a response, but
yeah, I think they have a long-standing relationship with Rebuilding Together. That's the one thing that Rebuilding Together does very well is collaborate. So if they've got these events that are occurring with a lot of our labor forces, that's pretty exciting, and really for us just to share that information. Lillian was talking about that communication and how important that is. If this stuff is existing, we might just be a conduit for sharing it and getting it in the hands of the people with the greatest needs.
I don't want to minimize the benefit of these 1-day events, but what we're really looking for is a more long-term partnership. And so, there are lots of 1-day events, like, I think the Habitat for Humanity repair, doing home repairs is really more of a kind of a one-shot deal. And what we'd love to be able to do is have a more kind of institutionalized relationship with the providers, so that we wouldn't have to be able to just do one house a year, or 2 houses a year. And again, it's great that it's being done, and I'm sure that Rebuilding Together is grateful for it, but it doesn't help their 500 home waiting list.
Sure. Yes.
Dan,
Yes.
I just remembered that the guy who does the veterans remodeling is named Charlie Felker with Promise Mobility. I'll send you his phone number. Now, this was quite a few years ago. I don't know if he's still doing it or if it's even being done more, but that was the focus of his business.
Thank you. Do we have, if there are no other agenda items, do we have a motion to convene our meeting?
Senior Fund.
I was going to say, I'm happy.
Oh, Senior Fund.
Yeah, sorry.
Thank you.
Sorry. I just want to let you all know, I'm sure you've all have read in the paper this year, we had 2 major housing emergencies in the city of St. Louis. The first one actually starting last December, right before Christmas, with Northview Nursing Home closing. Northview Nursing Home was the largest nursing home in the city of St. Louis. Nursing homes, when they close, are by law supposed to be giving at least 60 days minimum notice. They didn't even give 60 minutes notice. People were taken to over 15 different nursing homes in Illinois and in Missouri and in 4 to 5 different counties without their choice. They have a choice of where they should be able to live. And most of these people were moved without their belongings. And some people just with the clothes on their backs, and many people were moved on a December night with not even a coat or shoes or anything. One man was moved in his underwear. 2 people walked out and were missing. One person was found. The other person was found over 2 weeks later. And so that was one of the emergencies that we dealt with. This was all something that could have been preventable. Unfortunately, most nursing homes, I think over 75% are now for-profit entities, and they are able to take their funding from Medicare and Medicaid funding and move it to their other businesses, as this one did. This one in particular spent over $2 million on office supplies in 1 year. A lot of office supplies for a nursing home, folks. and not to the care of the people who live there or to the staff. The staff, they had 130 staff members, and 2 weeks before Christmas, they did not get their paycheck. This is happening across the country. You might have seen other stories about this that's happening. Just wanted you to be aware of that, we've been trying to work on changing policy in Missouri so that this doesn't happen again. There is a way for the state to be able to monitor these transfer of payments to other companies, and we just don't have the laws in place to do so. The second emergency we had was the closure in January, a month later, of the Heritage House Apartments. Heritage House Apartments was also, many of you know, a longtime low rate apartment building for many retired teachers. This also, a not-for-profit group was running this. It was nobody's fault, because they were trying to keep rents low so people wouldn't become unhoused, kind of going back to the topic we just talked about, that rent rates keep going up and people that are retired and on fixed incomes can't keep up with the cost. Anyway, we funded, our senior fund funded for both emergencies, over $150,000 to address the getting people at least to stay in hotels along with the city of St. Louis. And for the nursing homes, we funded many social workers to go out and do wellness visits. And thank you very much to Sarah and JFS for helping assist us with that program. The reason I'm telling you all this is that housing insecurity is a huge issue. And these things are not going to be one and done. I've been in the field for 40 years and I've never seen things like this happening, and it's going to be continuing to happen. So the senior fund we are working with UMSL CIAC, Community Innovation Action Center, and we're going to be doing an after action report. Because in the county you had Santa Ana closed. Now, luckily, Santa Ana, they had that more under control because it was part of, the HUD program. But I just want you all to be aware that this will happen again with nursing homes. This will happen again with people becoming housing insecure. We are working with the regional response team, and we will be sharing this information this fall. Would love for you all to come and just learn what we hear about. One of the things that we do know is that when, what is a definition of an emergency and who's responsible for responding? And both city and county have their city and county emergency management teams, but neither of these things really fell on that radar of an emergency. I mean, they saw the emergency as, well, let's transfer the people out of the Heritage House building because it had no heat. And once we transfer them to hotel, the emergency is over. Well, no, it's not. Now we need to find housing for 180 people who were used to paying rents of $600, $700, and $800 a month. Good luck. So anyway, not to be just a Debbie Downer, but I wanted you just to have this on your radar as something that we can all learn from with the after action report, and be looking forward to sharing that information with you all.
Thank you, Jamie, and thank you for all that you do. And you and I had a conversation, within the past month, and I think you are actually, helping somebody move possibly at the time. And I think I asked you, did you think that was in your job description when you took this job?
He's an older man who has a developmental disability and has no family. And so my husband said, "Is he moving in?" And we came that close.
Oh my gosh.
Along that,
Right, go ahead.
Yeah.
Along that same line, one of the conversations Jamie and I have had when we've met on different occasions is talking about developing leaders in the older adult arena. When you look across the spectrum, we have young Sarah sitting here, but we have, by virtue of the our ordinances, we have to be 45 years of age or older to be on this commission. And so our collaborations, obviously are geared that way. But when you look at the organizations that are providing the support and that have really built these foundations, these frameworks for success in all of these agencies, that group is retiring. And we don't see clear paths of who's coming in to champion older adults. And so we actually talked, I sit on the board of Lutheran Foundation. And so I've been in talks with them to say, how about somebody funding leadership development and what that looks like? So I sat at a presentation yesterday excuse me, that there's a small pilot program of leadership development, and those leaders are between the ages of 17 and 28. But it's focused on it's a Christian outreach where they're looking at using your heart and your resources, whether it's vocational or whether it's avocational, to become a leader in fields. So it's not anything to do with older adults necessarily, but that same model that they're building could be useful in us or finding, can someone do a white paper on that? What does that look like? So that's not really something that we as a commission, it's just an awareness of watching the champions for older adults aging and who's replacing them and what kind of skill sets are they coming in and what kind of knowledge base. So without that data that we keep asking for, you're asking someone to step in with a bunch of anecdotal evidence. And it's not very helpful for those that are going to step in and fill as we all retire out of our positions. It's just a comment I have.
Lisa, a bit of a follow-up on that is that I'm on the UMSL's Arts and Sciences Leadership Council, and there's a new dean there. And I did have a conversation with him about how disappointed some of us were when Tom Moiser was had his funding taken away and gerontology was looked at as, no longer an important area of study. And he seemed to be interested in looking into that whole issue. So I'll follow up with him because that was such a disappointment that that department was done away with.
If you get an opportunity to meet, I would love to join you for that.
Okay.
Because I think we rely on WashU and much that they offer. And UMSL used to be that leader. For those of you that have been around for a while, you remember when we did that forum with Tom Moiser, and it was really helpful. So yeah, I think those are the conversations that, since we are an advisory group, those are the conversations we could be a part of as well.
Yeah, Tom was a real loss to this community. He's the individual that introduced me to this commission.
Well, and also that program that he had at UMSL, where he his senior scholars program was,
Right.
he should, I mean, if he charged a little bit for that, I think it would have stayed. But anyway, that was just a wonderful way of connecting, getting older adults into that institution and addressing a lot of, I think it could have been a very successful program. So I'll see if I can set up a meeting, Lisa.
Thanks.
And the thing we lose along with leadership is institutional memory. Jamie, I was on a team back this was in the 80s, maybe early 80s. I was a child anyway. And a nursing home in the Central West End in the city, Carlson Tower, went bankrupt. The state took it over, and I was one of a 4-person team that relocated 200 residents in 2 weeks. Essentially, we lived in the place for 2 weeks and found places for 200 people in 2 weeks. So this isn't the first time. It's been done before, but thankfully it's long enough ago that folks don't necessarily remember it. But I just happen to be part of that. So that's.
Mike, you're absolutely right. I mean, I'm so fortunate that Bill Seedoff is our chair of our board, who used to be the Department of Human Services, the director of the Department of Human Services with the city. And if it wasn't for him stepping in, the people, it's like, and I worked for county government too for 18 years, and things just aren't written down all the time, you know?
I
And
remember,
so,
yeah.
so yeah, that institutional knowledge is huge. That it's a loss.
Well, these anecdotes also make me think about, you know, the consequences of tax reform. You know, you know, individuals are probably happy that their individual taxes might go down, but you know, wait a few years and we see these stories pop up. People, you know, fall through the cracks, and this is what doesn't get funded, fortunately. So thank you, Jamie, for that report. Are there any other items that I missed on the agenda? Do we have a motion to end our meeting?
I move we adjourn until September.
We'll see you all in September. All in favor?
Thank you,
And you
Dan.
have to have a vote on it. You didn't have a vote. You just had a motion in a second. I'm sorry.
I thought I would like to have a vote on ending the meeting. All in favor?
Aye.
Aye.
Aye. All opposed? See you in September.
Have a good
Thanks,
one.
everyone.
Good,
Thank you.
good summer.